Hello, and welcome to the Healthcare and the ADA, including people with disabilities webinar series. I am Pam Williamson from the Southeast ADA Center, along with Ann Deschamps from the Mid-Atlantic ADA Center. We will be your moderators for today's webinar. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You may reach your regional ADA center by dialing 1-800-949-4232. Next slide, please. Next slide, please. So, real-time captioning is being provided for today's webinar. The caption screen can be accessed by choosing the CC icon in the meeting control bar. As always in our sessions, only the speakers will have audio. So please remember that you may submit questions by typing them in the chat area box or press Alt-H and enter text in the chat area. If you are listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. This webinar is intended to share issues and promote promising practices in healthcare accessibility for people with disabilities. The series topics cover physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act, or ADA. These webinars occur every other month on the fourth Thursday at 2:30 p.m. Eastern Time, 1:30 p.m. Central Time, 12:30 p.m. Mountain Time, and 11:30 a.m. Pacific Time. By being here, you are on the list to receive notices for future webinars in this series. The notices go out 4 weeks before the next webinar and open that webinar to registration. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. Again, you may submit your questions using the chat area within the webinar platform. The speakers and I will address them at the end of the session, so feel free to submit them as they come to your mind during the presentation. Next slide, please. Next slide. If you experience any technical difficulties during the webinar, submit a private chat message to the host by typing in the chat window. Type your comment in the text box and enter. Or you may use the keyboard Alt-H to access the chat box via the keyboard keys. You may also email adatech@adapacific.org or call 510-831-6714, and that is voice and relay. Today's ADA National Network Learning Session is titled Personal Experiences with Healthcare Barriers in the ADA, a panel discussion. Healthcare is often unequal and difficult for people with disabilities. In this session, a panel of 3 women with disabilities, 2 who use wheelchairs and 1 who is hard of hearing, will share their personal experiences with healthcare. Each presenter will share an example of a great healthcare experience and a challenging healthcare experience. The panel will then discuss how the ADA either should have improved the challenging experience or was used to support a positive healthcare outcome. I'm pleased to introduce you to today's speakers. Our first speaker is Cynde Soto, who is a native Californian born with Arthrogryposis, a connective tissue disorder, and she also sustained a spinal cord injury 20 years ago. Currently, she works as a systems change coordinator for an independent living center in Los Angeles. At this time, she continues her advocacy work to promote accessibility throughout her community. Cynde says her job enables her to work for positive policy change concerning people with disabilities. It is important to increase civic participation through community organizing, education, and advocacy around issues that affect our community. Leadership development is also a crucial element of system change by working with clients at the agency she works for and beyond. Our second speaker is Christy Abrams. She is the hard of hearing specialist with the State of Arizona Commission for the Deaf and Hard of Hearing, navigating severe bilateral hearing loss since the age of 6. She is passionate about hearing loss, equal access, and effective communication. As a member of the Hard of Hearing program team, she leads the Hard of Hearing task force, presents training sessions for consumers, employers, healthcare, and public safety professionals and organizations across Arizona. Christy works one-on-one with hard of hearing consumers every day, providing them with information and resources so that they may live independent and empowered lives. And our third speaker for the day is Jan Garrett, who currently serves as the Deputy Director of the Pacific ADA Center at the Public Health Institute. She is the lead trainer, oversees all of the center's training and technical assistance efforts, and approves all curricula. Before joining the Public Health Institute, Jan worked as a disability civil rights lawyer and served as the executive director of the Berkeley Center for Independent Living, a disability-led organization that provides services for people with all types of disabilities. In her prior work and work with the center, Jan has over 25 years of experience providing guidance and training on the ADA and other disability rights laws. As a person with a disability, so Jan has a deeply personal understanding of why disability civil rights are so important. So, team, I'm going to turn this over to you. Thank you for joining us today.
Thank you so much, Pam. So today we will be talking, Cynde and Christy and myself, and this is Jan speaking, about our personal experiences with healthcare barriers and healthcare positive experiences under the ADA. And so I'm really looking forward to hearing the stories of my co-presenters as well. And when we get to everyone's stories, we will be stopping the share of the slides for a moment and then going to people's personal stories. Next slide. So the ADA National Network, actually Pam did talk about the ADA National Network, and this is showing a map on the screen of the 10 regions that comprise the ADA National Network. The Pacific ADA Center is in Region 9, the states that are in green, Arizona, Nevada, California, Hawaii, and the Pacific Basin territories. And then Pam is from the Southeast ADA Center. So her states are in blue on the map. There are many states in the Southeast ADA Center. And then Anne, our other moderator, is from Region 3, the Mid-Atlantic ADA Center, the states that are in a teal color. So thank you to Pam and Anne for all your work on these webinars and on behalf of the ADA National Network generally. Next slide. So today Pam did introduce our presenters. So Cynde Soto from Communities Actively Living Independent and Free, or CalLIFE. Christy Abrams from the Arizona Commission for the Deaf and Hard of Hearing, and then myself, Jan Garrett, from the Pacific ADA Center. And next slide. So I'm going to stop and let Cynde actually begin, and you can tell us anything that wasn't in your bio that you want to, that would be relevant for our discussion of healthcare today. And then after Cynde, we will move to Christy. And for now, if we could stop sharing of the slides. Thank you.
Okay, hello, it's me, Cynde. And the only thing, I think the introduction was quite good. Um, I'm very happy that the U.S. Access Board uh, put out their guidelines for medical equipment. And I don't know if Jan can talk about that, but anyway, I am a quadriplegic from birth. And I will tell you first a few details about my disability so you can better understand why having accessibility at medical facilities is crucial to me. Would you like me to continue, Jan, or wait?
Well, I mean, we can wait and we can move to Christy to say just a few words about herself and then I will, but thank you for that. Christy.
Okay, and is my audio coming through okay?
Yes.
All right, great. Well, greetings from Arizona, everyone. I'm happy to be here with you all today. I do have bilateral hearing loss, it's severe, profound bilateral hearing loss. And just to show you, I actually wear a power hearing aid in my right ear. And I was just implanted in May with a cochlear implant. And I'm so excited because they're pink. And ever since I was little, I wanted to have a pink hearing aid. So having a cochlear implant and a hearing aid, actually, that's called bimodal because I have two different modes of devices in my ear. And I'm just really thrilled to be here with you. Of course, being hard of hearing, there's a lot of information I want to share with you. Hearing loss impacts more than 1 in 5 people out there. And as our age increases, that number climbs much higher. More than 60% of people over the age of 60 have some level of hearing loss. So we really see that impacts us physically, emotionally, psychologically, and socially, and creates a lot of barriers to healthcare. So I'm really looking forward to talking with you more about it.
Thank you, Christy. That's great. So, and I'm Jan Garrett, and my disability is that I was born missing all 4 of my limbs. And I use a power wheelchair for mobility that I drive with my shoulder. A lot of times people ask me, how are you moving that thing? And sometimes if I'm in a particularly funny mood, I will say, well, it's mind control and I might use it on you if you're not careful. So, but and you'll find I joke about my disability a lot. A lot of people in the disability community do that because if you can't have humor about yourself generally and for the world, then it's a pretty dismal place to live. But at any rate, because I have such a significant disability and I use a mobility device, healthcare is often challenging in terms of the physical access to healthcare offices, access to the medical equipment, as Cynde was just talking about, which now we have some brand new standards for that medical equipment from the U.S. Access Board. And healthcare has been a challenge for me, both from the attitudes of healthcare providers and from the physical aspect of healthcare facilities. So that's all I'll say about my experiences right now, but we can share the slides again. Thank you. Next slide. So, and we kind of have shared this of ourselves, our organization, description of what we do, and a description of our disabilities. So on to our next slide. So we're going to look a little bit at the ADA overview as it applies to healthcare. And so we have a few slides on that, and then we will move to the individual presenter presentations. Next slide. So in case you don't know, this year is the 34th anniversary of the ADA. And there is a big banner on the screen that is talking about July 26, 2024 being the ADA 34th anniversary. So it was signed into law in 1990. And, it's a law that looks pretty good for being in its 30s. But it's also a law that a lot of people still don't seem to understand or seem to comply with in many areas, including healthcare. So that's why all of us are here today. We're celebrating the ADA. We're celebrating that it's here and provides rights for us, but also to educate others on what the requirements are. So making sure that people do know that this is a civil rights law. Next slide. So I'm going to pause here for a moment and let people read the slide. Okay, so hopefully folks have had a chance to read it. I will now kind of go through it. So the ADA in general means that any entity that is covered by the law, and that is state and local governments, so cities, counties, states. It is private businesses, private employers, state and local government employers, private nonprofits like the Pacific ADA Center and like Cal Life and others. So anytime you're talking about a covered entity under the ADA, you have to provide certain things as far as the ADA requirements are concerned. And that includes reasonable accommodations in employment, accessible buildings and facilities, accessible websites and mobile apps for the requirements for those, communication aids and services for people with hearing, speech, and or vision disabilities, and reasonable modifications to some policies, practices, and procedures under the ADA. So all of these are required things to happen under the ADA. And if you're covered under the ADA, you have to provide them. And then generally, the text in the blue box is talking about the ADA having 5 titles, including employment, state and local governments, public accommodations, which are private businesses and private nonprofits open to the public, telecommunications, which is how people who are deaf and hard of hearing or have speech disabilities use the telephone and also have access to 911. And then the last title, or Title 5, is miscellaneous provisions, but that includes the fact that you cannot retaliate against somebody with a disability. Next slide. So under ADA Title 2, that is public entities, state and local governments, every program, service, and department. And I will stop there for a minute and let people read the rest. So when you're talking about a public entity, in general, they cannot discriminate against people with disabilities. And as we just talked about on the last slide, they have to provide an equal opportunity to participate in program services and activities. They also have to provide program accessibility to their buildings and facilities that existed before the ADA. So that means that not every building has to be accessible, but every program must be accessible that they offer. They also have to offer effective communication and reasonable modification of policies, practices, or procedures. So these are public entities, state and local governments. Next slide. And then actually, this is ADA Title 3. I'm sorry, it says ADA Title 2 continued. That's actually an incorrect slide title. I will stop and let you read this for a moment. So ADA Title 3 applies to businesses, nonprofit organizations, and includes all places that are open to the public that are not government, that are privately owned and operated. Again, like state and local governments, public accommodations cannot discriminate against people with disabilities, and public accommodations have to provide, again, an equal opportunity to participate in their goods and services. They have to provide readily achievable barrier removal for their buildings and facilities that were constructed before ADA. And like Title II entities, they have to provide effective communication and reasonable modification of policies, practices, or procedures. Next slide. So now that we've gone through a little bit of the ADA, we're going to talk about challenging healthcare experiences. And let's move to the next slide because that has the order. So I will start, and then it will be Christy, and then it will be Cynde who follows Christy and myself. So we can stop sharing the slides for a moment, and I will share one of my many challenging healthcare experiences. So when I was in college, there was a student health service where many people experience that as part of their higher education. And it was a doctor I had never seen before. And it was getting toward the end of the first semester. So it was wintertime, late fall, wintertime. And I had gotten the flu. And I got a very severe kind of respiratory type of flu where my sinuses were impacted, my throat was impacted, my lungs were impacted. I had a cough. So I was really quite sick, and I had a fever at that time. And so I went to the student health service to see what they could give me, if anything, to help me get through my symptoms, of the flu. And the doctor walked in. The doctor was kind of a young doctor, male doctor. And he looks at me, and instead of introducing himself or saying, "Hi, how can I help you today?" or any of those things, he said to me, "Thalidomide, right?" And thalidomide is a drug a lot of people may not know that pregnant women were given in the late 1950s and early 1960s that caused a lot of limb deficiencies and limb malformations. And as it turns out, that I learned later, it may be true that my mother had taken thalidomide. At that time, that's not something that my mother nor I knew. And I felt like it was just a really strange, really rude thing to say, to walk in and say to someone, "Thalidomide, right?" And so I sort of sat back and smiled for a moment and said, "Jerk, right?" Back to him because, even though he was a doctor, that was a really not polite thing to say. And so I did educate him on the fact that he may want to, in the future, introduce himself to somebody that he doesn't know and ask why they are there, because the truth is, my disability was not why I was there at all. My disability had nothing to do with me having the flu. I simply had a flu, needed something, hopefully some medication to help me with that flu, and to be able to move forward. So that is my top list of my negative healthcare experiences, with a doctor. Unfortunately, I've never had anything like that, after that point, and I didn't have to be so surly in my responses to new doctors that I met. But anyway, that's my experience, and I'm happy to turn it over to Christy to share her challenging healthcare experience.
Thank you, Jan. It's so great to have these conversations with each other, and hopefully everybody can really gain some good insight. I just wanted to share before I dive into my challenging experience with working with a state agency, the Commission for the Deaf and the Hard of Hearing. I am really fortunate because I'm surrounded by teammates who are extremely knowledgeable about providing inclusive environments and accommodations. And I, of course, I'm really eager to learn American Sign Language, but being hard of hearing myself, that's not something that I'm fluent in. I love sign language, but I want to bring that up because so often when I go to a healthcare appointment or I'm in a healthcare setting, if I share that I do have some hearing loss and I am hard of hearing, very frequently I'm offered an ASL interpreter. So it's just really important to consider the individual that you're talking about today. I'm fortunate to have a CART provider here, communication, access, real-time translation. The captioning is what gives me equal access and effective communication. And unfortunately, CART is the best kept secret. I don't know how many of you out there are familiar with CART, but whenever a deaf person can request an ASL interpreter, a hard of hearing person can request CART, because captioning is what, if we're not able to understand speech clearly, the captioning can give us that access. I just wanted to start by sharing that. For me, my situation, I kind of want to walk you through an example. The challenges begin right up from the beginning of a phone call, of making an appointment. That can be really difficult for any hard of hearing person. We really often prefer texting or emails because phone calls can be really challenging for us to understand correctly. Sometimes if someone's giving me information about an appointment and they say February 15th, I might hear February 16th. Those numbers can sound so similar. Even the appointment time, is it 2 p.m. or 3 p.m.? I'm not sure. So getting information over the phone right away is a barrier. The next step, when I walk into a reception area, oftentimes I'm met with a plexiglass or a glass barrier, and the receptionist behind it will often have a mask on. And for me, being hard of hearing, the visual is so important. Lip reading is something that people will say that they do, but being hard of hearing and even being a really good lip reader, you can still only get about maybe 25%. So it certainly helps to be able to see that face and to be able to see the information on someone's face, but it still doesn't give me full access. And again, when I had someone wearing a mask or had that plexiglass barrier, it really diminishes the sound of speech. So that's another barrier. Then if the waiting room may be long and large, maybe there's several doors, I have to keep looking back and forth. Where are they going to come out to call my name? If they stand behind the door and I don't see them, it's really easy for me to miss hearing my own name. And so in the past, I've actually been sitting there waiting. They came to get me in the reception area, but I didn't hear them say Christy. So I was wondering if they were running behind because I was waiting and waiting, and I actually missed the appointment altogether. And when I went to the desk and they said, oh, we called you, but we thought you had left. So that's another barrier. I actually had to reschedule that appointment. So often in medical offices too, there might be a TV in the reception area, and they might be sharing really important information about their office or other information, and often the captions aren't on for that. So that's pretty important. The story that I want to share is actually about being a hard of hearing mom. So I went to the emergency room one night with my teenage daughter who was not feeling well at all. And that in itself was scary. I was tired because it was late at night. I was stressed because she wasn't feeling well, and I didn't have time to request CART. So we arrived at the emergency room, and right away, of course, everyone has masks on. And being stressed, that already makes hearing all the more challenging. And the nurse was talking to me, and they were asking questions about my daughter. And I let her know right away, I'm hard of hearing, I'm not understanding you clearly. She happened to have a very high voice, and pitch can really affect my ability to understand. And she also had an accent. So I was really struggling. And so she kind of put up her hand to me and said, made the motion to, that's okay, never mind for you, I'll just talk to your daughter. So she kind of excluded me from the conversation and started talking to my teenage daughter. And so I said, just a second, it's really important. I'm the mom. I need to be and this communication circle. It's really important for me to know what questions are being asked and to be a part of the conversation. So that just really did not feel well at all. And it was something that was hard to experience. And one other example is my daughter actually was going to have her wisdom teeth out, and we were in the office and they wanted to share an important video about pre-op and post-op instructions for my daughter's wisdom teeth procedure for the next day. So I said, is the video captioned? And they said, well, some of it is. And most of it wasn't, of course. So I didn't have access to all that information. So I let them know how important that is. And so you can see the steps when we're hard of hearing all along the way, there's barriers. And so it's really important to have conversations about it and for everyone to keep that in mind. And I will let Cynde take it away.
Thank you very much. As a very informative. So I will start off by giving you a few more details about my disability. So I was born with arthrogryposis, and that means that all of my connective tissues, muscles, and all of that are contracted from my shoulders all the way down to my toes, even my toes. And then, like as was talked about earlier, I sustained a spinal cord injury, and so many people don't really know what that does to a person. So it can affect our blood pressure, our sensitivity to heat, bladder and bowel issues, among other body functions. And also because since I've never walked or anything like that, I've always used a wheelchair. My bones are rather thin because they have never been weight bearing. So in other words, I could be a bit of a challenge and rather delicate if for the medical field to deal with. And so my biggest worry at this point is that I have an indwelling catheter, which means that there's a tube inside my bladder, which allows me to urinate. And so in that case, I should have a bladder exam done periodically to check for abnormalities such as bladder stones, cancer, that sort of thing. And these exams can often be done in a doctor's office. However, I cannot get out of my wheelchair safely, and I could not be transferred by people like nurses and such, because they could be hurting me accidentally. Even though a lot of these exams are performed at doctor's offices, I cannot find a urologist who could actually help me in the way that I really need and to do it safely. So that means I have to go to an outpatient clinic. And this is really very problematic for me because they want me to go very early in the morning, even before my paratransit service starts. And I also have to make special arrangements with my caregiver to change their working hours. And that's not always possible. I cannot make my own appointment at the outpatient clinic. They tell you what day, time, etc. Now, at the outpatient clinics, they have patient lists in order to transfer people who are unable to get out of their wheelchair and go on to the exam table. Another thing is that when this procedure is done in the outpatient clinic, they have to sedate me, which is not that easy because of my complicated issues with my spinal cord injury and everything. So that is even more of a worry for me and my caregivers because they have to make sure that I'm awake and ready to drive my wheelchair which I do with my chin. So my solution really to this problem is have doctors have patient lists available to assist in the safely transferring to the exam tables. Thank you.
Perfect. Thank you, both Christy and Cynde, for sharing your experiences. And there are definitely some things that the ADA would say about both of your experiences in terms of requiring effective communication, computer assisted real time translation for Christy, especially in dealing with, well, herself or her daughter's experiences and being there. And then, but certainly not being shut out and being discriminated against by the healthcare providers. And then Cynde being able to get an appointment that fits with her schedule so that her transportation, her attendant care, all of the things that she needs to be able to transfer safely to an exam table are all taken care of. And those could all be considered reasonable modifications of policy, practice, and procedure. You may have a policy that says we have to give you that early morning appointment. But the truth is that they may be able to modify and should be able to modify that policy if you say that doesn't work for me because of my transportation, because of my attendant care. So all of these things are things that the ADA, can address, as well as just people being aware of the fact that they may be ableist and maybe unintentionally ableist, but they may have their biases about disability just because they don't know enough about people with disabilities. So educating healthcare providers and everyone that we come in contact with about people with disabilities to make sure that you're not either intentionally or unintentionally showing bias toward people with disabilities. So thank you for that. Let's put the slides back up for a moment. And we'll move to the next one. And now we'll share positive healthcare experiences that all three of us have, because it's not always negative. Sometimes we do have things where we have experienced positive things. Next slide. So once again, I'll go first, and then we'll have Christy and then Cynde go and present our positive stories. So we can stop sharing. And so my positive story is both a little bit of a challenging story, but also a positive one. And it started when COVID actually began and when we were really in the heat of COVID-19. And if people will remember, you had to go get a vaccine and a test potentially for COVID. And where that was happening was mostly in a parking lot where you would drive into, and that you were then waiting for a vaccine to be able to give that to you. And what the problem was is that we pulled in the van, and my husband Dan was driving. I was sitting in the back, and we had one nurse that sort of came out of the area, the drive-through area, and said, I need you to give me your arm so that I can give you the vaccine. This was the very first vaccine that any of us were getting. And my husband said, oh no, I'm here. I've already had my vaccine. My wife is in the back in the van and she needs the vaccine. So we had to open the van door, and the nurse had to get in the back of the van, and looked at me, and I said, well, I don't have an arm for you to give me the vaccine in. So what usually happens is that I usually get the vaccine in my hip. And I had on a skirt specifically so it would be easy for them to give the vaccine in my hip that day. And the nurse kind of looked a little bit panicked, deer in the headlights kind of look, and said, just a moment, please wait here. And I'm going to go talk to my colleague. So she went behind this like little, area where they had the nurses, and then came back out with a second nurse. So both nurses then climbed into the van, and they both were like poking around on my hips, to say, well, where can we actually put this vaccine, and what can we do? And I said, well, I did explain it to the first person, so I think we can just do it in the hip, and it shouldn't be that big of a problem because I have that done all the time with other vaccines. And so finally, what I say is common sense prevailed, and that is that they actually agreed to just let the one person give me the vaccine and then let me move on. And so the second time, the second vaccine that we had to come for like 2 or 3 weeks later when we were having our first vaccines, and I came to the same drive-through location for the second vaccine. And as it turns out, it was the same nurse that gave me my first vaccine. I don't know what the chances of that are. Not very good, because there were a lot of nurses and a lot of drive-through lanes in that place. But it was a brand. The same nurse was the one that gave me the shot before, and what she said is, "I remember you." I said, "I bet you do." I'm usually fairly memorable, and what she said is, "I'll just go ahead and give you the vaccine now. We don't need to check with anybody else. Go ahead and we'll give you the vaccine, and you can just leave and do what everyone else does. Wait your 15 minutes and you're free to go." So that's where ultimately, even though it was challenging at first, them not wanting to give me a COVID vaccine, it ended up being positive because I was able to convince them that giving me the shot in my hip was really, as long as they knew what they were doing about where to give it to me in my hip, it was really no different than giving it to you in your arm. And they just needed to give it to somebody in a different place. And they had never been trained and never even been considered that they might have to give somebody a vaccine or any kind of shot somewhere other than their arm. And so this was really an opportunity to educate these nurses who were going to be working for quite some time in the COVID pandemic and doing a lot of vaccines, a lot of educating others. It was an opportunity for me to educate them about how important it was to know that not everyone gets their shots or their medical care in the same way, that you may have to modify your policy about giving shots in the arm in order to give it to someone where they can actually accept the shot. So that was my experience during COVID, and I will pass it over to Christy for her positive healthcare experience.
Thank you, Jan. I think probably so many of us have particularly interesting stories from the times of COVID. And I know my positive experience actually, and this is regarding myself, I actually had to go to the urgent care, and it was during COVID. So right away, of course, again, everyone had masks on. And if you think about it, for anyone back during COVID, no matter your level of hearing loss, the mask made it really challenging. So again, my stress was going because I was trying to figure out, I didn't have time to request CART. And so I was trying to figure out ahead of time how I was going to navigate the appointment and it was going to be with someone who wasn't familiar with me in an urgent care that I hadn't been to before. So I was really pleasantly surprised. I was there, and the healthcare professional came in, and he was really open, curious, patient, and eager to talk with me. And I had shared right away, of course, being upfront, I'm hard of hearing and you have a mask on, and that's just going to make it really challenging. And he went 6 feet back a little bit. He took the mask right off, and he said, "My sister is hard of hearing." So I familiar and took the mask off, and we're 6 feet apart, so I think we can figure this out. And he just had I felt connected right away because he was sharing a little bit about himself and that he was a little bit familiar with someone that was hard of hearing, which probably so many of us are. And so he made that connection with me. And he didn't say something like, let me know if you don't hear what I say. So often people will say, just let me know if you don't hear me, or let me know what you don't hear. And if you think about that, how is a hard of hearing person supposed to let you know what they don't hear? So he didn't say that. And when this doctor shared information with me and was sharing questions and instructions, he said to me, did I explain that in a good way? What other details can I add? Because he really knew that this was about two people communicating, and both of us had a part in making this communication happen. He wasn't coming at it like I'm hearing impaired, which is another term at the commission that we don't like to use. It's a negative term, being impaired. So he approached it in a way of, how can we make the communication happen? How do we make that access happen? Because when I have equal access and effective communication, it really improves my experience all the way around. It alleviates stress, and it makes it more comfortable to be there. And again, when someone's just patient and they have those communication skills, it changes the feeling of the entire appointment. When someone has awareness that it's not, again, I'm a patient with a disability, which is fine, but they approach it as there's two of us in it together, and how can we work it out? It really is a win-win for everybody. And so I always just tell people too, if you obtain the person's attention first, slow down a little bit, speak naturally, and have that 100% communication face-to-face, because so often healthcare professionals are really busy. They're multitasking, moving about the room, and as soon as you turn away your face, it makes it really challenging for not only hard of hearing people, but for any of us when we're not feeling well and we're tired. It can be hard to communicate and follow the important information that's being given to us. So it's really helpful to do that. It's really helpful to put information, important details in writing whenever you can, I think, for anyone. I also want to just say resources, having resources on hand, like the Hearing Loss Association of America. They have a great guide for effective communication in healthcare, and this is really helpful for anyone to review. So it's just important to be prepared and know who you're meeting, and be open and patient, and I think that makes all the difference.
That's a great story, Christy. Hello, this is Cynde again, and I have a pretty good story. I was in need of eyeglasses because I could tell they were not, eyeglasses I have were not sufficient. So I started calling around to optometrist offices because I haven't been to an optometrist for many years. So the first one I called, I said, I need an exam. I'm not able to transfer out of my wheelchair. They said, no, we can't do that. Then I called another one. The next one said the same thing. You have to be able to get out of your wheelchair to get into our exam chair. And I called another one, all in my city. They denied me service as well. But on my fourth try, I found an optometrist that said, no problem. We can do that. We will just move our chair, and you can see if your wheelchair is the right height, etc. And we'll be happy to do that. So I was so overjoyed. I went to the appointment. They were super nice. They had the chair moved even before I got there, and I had a successful eye exam. They did use some of what old-fashioned, you might say, put a lens in front of your eye and, do whatever they do with their magic. And I now have eyeglasses and I can actually see. That is, one more thing is the optometrist asked me, where do I go? What do I look at? What do I need to see? And I told them I need to see curve ramps. So I do need, bifocals. So they made sure that when I looked down at the program, I could see very clearly. And I also looked to my right side at a display area for the to connect my to operate my wheelchair. And I told him that too. And so he made a little extra bifocal to that side of that I need to look at. And so I mean it's a godsend, I'll tell you. I really like him. They are very super nice, and I'll be going back to him again. Thank you.
That's perfect. Thank you both to Cynde and Christy for sharing your positive experiences, because we really want healthcare providers and others, businesses, nonprofits, to know that if you just listen to people, if you are open to making sure that people have a good experience with you, if you ask questions, this is the key thing. Ask the person questions. Well, what do you need? How can I best help you? How can I best provide this care to you? That's really, I think, that the best practice for everyone. How can I best provide you with service if you're a business owner? How can I best provide you with programs if you're a state or local government? So even outside of the healthcare framework, asking people what they need, what kind of access do they need, what kind of communication do they need, what kind of physical assistance do they need, what kind of information do people need to have shared with them that maybe no one else has ever shared with them. Like you have the option for, these bifocals that have different, places in them where you might be looking in different directions. Nobody may have ever told you that you have that option, or nobody may have ever told Christy, the option of, well, I can just back up and take my mask off, and we can be able to talk so that you can read my lips a little bit more, or you can hear my voice better, and also, just be able to say to Christy, what else do you need? What other information do you need that I have not given you? And if every healthcare professional would do that with every person, well, whether they have a disability or not, with every patient that they see, the healthcare system would be much better. And I think people would have a much better and easier time within the healthcare system. So, Christy and Cynde, did you want to share anything further right now, or should we move on?
I'm good.
Okay. So I believe that we are almost at the point where we can go to questions. If we go to the next slide. Yeah, but before we do that, I wanted to share something about some research that the Pacific ADA Center is participating in that involves healthcare. And we're going to put something in the chat as well that people can access. So the Pacific ADA research team from the University of Guam, which is one of our the parts of our region that we serve. Guam is in the Pacific Basin. And the University of Guam has researchers that are looking for assistance with sending out an online survey that they have. Now, this online survey is only for Region 9, which is California, Nevada, Arizona, Hawaii, and the Pacific Basin territories. But the survey is called Identification of Barriers for Healthcare Workers, Assuring Access to Healthcare for People with Disabilities. So the University of Guam team is actually looking for participants from healthcare workers, any kind of healthcare worker. That can be a doctor, a nurse, a dentist, an ophthalmologist, anybody in the healthcare industry, and people with disabilities, or people who are attendants or caregivers for people with disabilities. So it's really healthcare workers of any kind, people with disabilities, or attendants or caretakers for people with disabilities. The survey takes less than 10 minutes to complete, and each participant, and you'll put your email in there, and you'll get a $20 Amazon gift card as a token of appreciation if you complete the survey. So we're not asking you to do it for free. We're giving you at least a small token for that. And it would really, really be helpful to both the Pacific ADA Center and the University of Guam to know a little bit more about what healthcare workers are experiencing and what people with disabilities and attendants are experiencing in as far as barriers to assuring access to healthcare for people with disabilities. So I believe that the URL link and the passwords are being placed into the chat. One is for healthcare workers. It's a separate one. And the other one is for people with disabilities or their caregivers or attendants. And so these are two different links that are being placed in the chat. And if people are interested in being able to participate, please do save the chat, hopefully, and click on the surveys and take the surveys for us. So thank you for that moment of interruption here, so that because the truth is that if we don't do research about people with disabilities in every context, including in healthcare, we don't have the evidence, we don't have the statistics, we don't have the specific information that we need to show the healthcare industry how important it is to be able to offer that really important, access to healthcare. So that's why the research is so important. And we guarantee that this research will be shared and not simply put on a shelf somewhere gathering dust. We will make sure that people get access to what the information is that we find from it. So thank you for that. And I will turn it back over to our moderators.
Thank you, Jan, Cynde, and Christy. So we appreciate you sharing your stories, both the challenging and the positive ones. It's always good to hear both sides. So at this point in time, we are going to open it up to questions. So you can reach out to us via the chat. And so you can the chat area, you can ask your question there. And so feel free to ask any questions that you may have. And at this point, I am going to start with a couple of questions that we had. So I believe, Christy, this question was probably best to go for you. So we have someone that is concerned about healthcare worker who is hard of hearing and who is concerned about healthcare workers who are wearing masks, and they find it frustrating since they do lip read. You gave an example of your personal story of how you made it work. Do you have other ideas on some possible modifications that might work for someone?
Thank you, Pam. I just wanted to clarify, did you say that this was a healthcare worker that's hard of hearing themselves working in the field and they're hard of hearing?
No, this is a patient.
A patient. So I think the most important thing is to just really become comfortable with self-advocating and think of yourself a little bit like a teacher, because unfortunately there's a lot of people who they don't know for sure what, for example, what CART is, like what we have here today, a real live human being is providing the captioning. It's the gold standard, it's the most accurate, and as a hard of hearing person for appointments, you have the right to request this. It is helpful, of course, to have time so that you can schedule a CART provider. It can be hard to get maybe last minute. And just to kind of make sure that they understand the difference between, a lot of times if someone says, I'm deaf, What does that mean? Because we have people that are culturally deaf and use American Sign Language, and we have people that have various levels of hearing loss that don't know sign language, and captioning is what can give them access. And I think just having strategies, really telling people specifically, could you please face me 100% of the time? When you look away, I can't understand. When you have a mask on, it diminishes the sound of your speech. I can't understand what you're saying. To really give them the details so that they understand. Because if we just said, I'm deaf, or I'm hard of hearing, or I'm hearing impaired, which is what some people say, that's not my favorite term, but and it's not a term that we really use anymore, hearing impaired, because it's negative. But we really just need to educate people, and we need to be as educated as possible ourselves. And I think one of the most important things is connecting with other hard of hearing people. If you're hard of hearing, join organizations like the Hearing Loss Association of America. Spend time and connect with other hard of hearing people so you can become comfortable with your own disability, with your hearing loss, and practice talking about it and practice asking for what you need. I hope that helps.
That's excellent information, Christy. And someone just put in the chat area that there are certain masks with plastic windows that allow speech reading. Safe and Clear makes the FDA approved communicator mask. And then so there's also an app with speech recognition software like Google's Live Transcribe. And I actually know of someone who is hard of hearing who keeps Safe and Clear mask with her, and will ask medical providers to switch out mask. It's just something that she's chosen to do proactively. It's not required, but it's something she's chosen to do, and she's had success with that. So.
Yeah. And this is Chrissy, if I could just respond to that. I think that that can be really helpful as long as people understand that it may not give us 100% of communication. So it definitely helps if we can see the face, but sometimes that barrier can still diminish the sounds of speech. I love Live Transcribe. I have it on my Android phone. But sometimes if someone has an accent, or if there's other background sounds, it might not be accurate. So it just depends on the situation. And if you're being given really important information in a healthcare setting, CART is probably, or it is the best way to go for the accuracy's sake.
Excellent information, and a good reminder for all of us. So we've had someone who is wanting to learn more about communication aids and services for people with hearing and speech disabilities. So do you have some resources, Christy, that you could share maybe in the chat in addition to voicing it?
Yes, and I'm sorry, I was reading the captioning. This is someone that is looking for information and resources for assistive technology yes, okay.
Yes.
Okay, I can definitely add some information. I'm going to put my email in the chat too, so people have that.
That would be great, because I think there are a couple of people that wanted to know if you would share your email. So that's great. Thank you. So. All right. And the other thing is, I saw that you put this information in from the Hearing Loss Association of America, but if you could also put the Guide for Effective Communication in Healthcare in the back in the chat again, that would be very helpful, because we've got a few folks that missed it the first go round.
I'd be happy to do that.
So. All right. So Jan, I think this question may be for you. It says, can you share the new standards that are coming out for clinics? I noticed that you put something in the chat regarding the new medical diagnostic equipment standards. So do you want to mention anything else about that?
Yes, thank you. And I'm about to put the Federal Register, the U.S. Access Board final rule, because what I posted in the chat was from the U.S. Department of Justice, and it's a final rule on medical diagnostic equipment, but it's specifically for ADA Title II, which is for state and local governments. And so I wanted to just put the Access Board, which really could apply to a lot of different kinds of healthcare facilities, because as we know, most healthcare doctors or clinics or other facilities are actually private. They're actually private businesses. And so we want to make sure that you can also have access to the, U.S. Access Board standards, their final rule, which are, I think, quite similar to what Department of Justice published for ADA Title II, but we want to make sure that you have all of it. So yes, so Title III ADA would apply to private hospitals, private doctors, private clinics that are generally considered private businesses. And also, a lot of those businesses would get federal financial assistance or federal money. So they would also be covered by what's called Section 504 of the Rehabilitation Act. And Health and Human Services, the U.S. Department of Health and Human Services, has also said you have to have these medical diagnostic equipment, and you also have to have a lot of other requirements to make sure that healthcare is actually accessible under the Rehabilitation Act. So I'm going to be trying to find links for all of those in just a moment.
Thank you, Jan. I appreciate that. So, all right, we've got someone that is asking, are you aware of any research that shows the impact of a pocket talker for communication access in healthcare? And Christy, that looks like a question for you.
Yeah, that's a great question. And oftentimes we present to healthcare professionals all over Arizona, and this is one of the items that I have on my slide, because it can be really helpful for people who have a mild, moderate hearing loss, and they, unfortunately, only 1 in 5 people who need hearing aids has them. So you have a lot of people out there with mild, moderate hearing loss or even greater hearing loss that don't have they're not treating their hearing loss. So they're really struggling to understand. And so having a pocket talker can be, for some people, helpful, because you would speak into a microphone and then the patient would have the direct access amplification. It doesn't work for everyone, depending on your hearing loss. And again, when we're hard of hearing like myself, so many sounds of speech can be missing. So it just depends on the situation. I think it's really important when you're with a patient, to think about background sounds. If they have their TV on, if you could mute that, anything you can do to make the environment as quiet as possible will also help. And lighting is really important. You want to have lighting in front of the speaker, not behind, so that you have a shadow in front. But a pocket talker can be helpful for some people.
Thanks for the information. And so that's a technology that I was unaware of, so maybe other folks may not be aware of it either. So thank you. Anne, do you have any questions to ask?
I was tracking some of the questions because they're coming in fast and furious now. And I think this can be for Jan or Cynde or Christy. Are children who have disabilities ever formally educated about their rights and self-advocacy skills? Oh, Jan, you're on mute.
This is a great question. I want Cynde to answer this one at least first, since Cynde is the advocacy person.
There you go.
Sure. So I would say in schools, no, it's not part of their curriculum. It would have to be maybe a peer support group, and there are very few of those type of groups to join. But that is an excellent question, and I will talk to a few youth organizers And I will, that's a great question. I'm going to ask them about that. And then I could, if I do find some good links or good groups, I will pass that on to Jan. If you would like, Jan.
Sure. That would be great. And we can share that. Thank you, Cynde. And I know, I mean, I grew up with my disability as well. But I grew up in the dark ages, before the Individuals with Disabilities Education Act. Yeah, we had to hunt and gather, for food and when I grew up. And so cause I'm getting, of that age. So we actually did not have, I was mainstreamed, but it was because I went to a Montessori school. And so I was, fully included with other kids without disabilities. But what that meant is that, of course, nobody really even acknowledged my disability growing up, whether it was in school or in the neighborhood. And so I never really got any resources. And I think my parents got very few resources, back in the day when I grew up. There are now parent training information centers. There are some great resources for parents out there. Also resources for children who might fall under the Individuals with Disabilities Education Act or IDEA, and to get services and supports under IDEA. There are resources that can help people with advocacy, that help the parents with advocacy for those IEP meetings, individualized education plan meetings. But certainly there are a lot more resources out there for parents, and hopefully those will lead to more resources for young people, and children themselves. At least, it has to obviously be geared to so that children can like it and take it in and use it. But I think that would be a great toolkit for somebody to create, is something for children to be able to understand more about what their rights are under these laws, and what does a right even mean, and what should they ask for, and when can they ask for those things, and all of that would be really extremely helpful, I think.
May I add one thing?
Sure.
Of
Okay,
course.
so in California, there is a program I just remembered. It's called YO, Disabled and Proud. And it is a leadership academy and a leadership group that's statewide. And they assist students, I believe, is under the age of 24. And they do a lot of advocacy. So I will contact that person who organizes that and ask them about this. Thank you.
Yeah, Jan, I also wanted to add that quite a few of the SILs provide pre-employment transition services, which include self-advocacy skills and teaching self-advocacy skills. And that's usually for people who are transitioning from secondary school to life after secondary school, but it can also go down as young as late elementary school as well. So I think if you do some searching online, there are probably pockets of fabulous self-advocacy programs. We just need to spread them all around for everybody.
Yeah, absolutely. And let people know about the ones that are out there doing good work,
Right.
and replicate them. Like you're saying, let's have them everywhere.
Yeah, and oh, Emily says youth leadership forums. Yeah, and I know in Mid-Atlantic region we have great youth leadership forums for high school students. Yeah, I think it's again we've got to get the word out for everybody.
Yeah, and that the resource that Cynde just mentioned, Yo Disabled and Proud, that is a youth leadership forum.
Oh,
So
good.
And California was actually the first state to have a youth leadership forum. So, I mean, not to toot our own horn here, but they've been around for a while. So we're really proud of them.
I think you should toot your own horn, Jan. It's fabulous. We love California. All right, Pam, back to you.
All right. So I'm going to do a little transition here because I think it's so very important, and Jan will give us a chance to plug the emergency preparedness information. somebody is asking some of the barriers that you faced accessing emergency preparedness resources, and how those can be addressed more to be more inclusive and responsive to the needs of people with disabilities.
Yes, absolutely. And the Pacific ADA Center has taken a lead on that for quite some time among the ADA National Network Centers, although many of the other ADA National Network Centers are doing work on emergency preparedness. And we at the Pacific ADA Center have worked a lot with Vance Taylor, who is at the California Office of Emergency Services, their access and functional needs department. And in the emergency management and preparedness world, access and functional needs is how they kind of refer to people that may have additional needs during an emergency or disaster. So it could be people with disabilities, it could be older adults, it could be pregnant women, it could be people living in poverty. And certainly can be, people who just have general additional needs. And so we definitely want to get back into doing more work and putting out more webinars and information on emergency preparedness. And I think definitely if you contact the Pacific ADA Center and really the ADA National Network, I think many centers would be able to tell you of the work that they're doing with people with disabilities and emergency managers to make sure that people are providing effective communication during disasters, that they're providing the shelters that are integrated and not specifically sending everyone with a disability to a medical shelter, that they're making sure that shelters are accessible throughout the area, that they have transportation to make sure that people can get evacuated and get to an emergency shelter, that they provide information on service animals and emotional support animals in shelters. So there's so many aspects of disasters and emergencies that need to be addressed and that emergency managers need to understand throughout the country. And I will also just mention that FEMA, the Federal Emergency Management Agency at the federal level, does have a disability integration and coordination group of coordinators. And they are really great, and they specifically know about disability and emergencies and what to do. And they are usually dispatched to wherever the big disasters are in order to provide that really valuable knowledge and information. I know our Region 9 person goes all over the place outside of Region 9, even when there's major disasters. So that's a super important resource as well.
Thank you, Jan. So, and as we know, many times these issues will kind of merge together. So it's good. It's always good to have this information that we can share. So, Anne, so
Yes.
next question.
Yes, Helen asked a great question that I think it would be wonderful if all three panelists could respond to, because I'm curious about the answer as well. How do we advocate for changing the culture of the medical field, trying to, quote, fix everything, oftentimes leading to unnecessary procedures, operations, and medicines, not to mention attitudinal barriers? So, Cynde, do you want to take a stab at that first?
I'd rather have Jen do that.
Okay, all right, sure.
Well, how about if we ask Christy if she wants to go first?
There you go.
Okay, thank you. And that was a loaded question. So, Anne, I'm just going to have you say it one more time so I can absorb it. And I'm thinking about it, but.
Sure, absolutely. How do we advocate for changing the culture of the medical field, trying to fix everything, oftentimes leading to unnecessary procedures, operations, medicines, and my addition is, and attitudinal barriers?
Well, I think it's such a multi-layered question. I think nothing for us without us is what I'm thinking about. I think you really need to go to the people, like having this presentation today, having people involved that have the various disabilities that are living it, and making sure that they're involved in creating the policies and making sure that they're getting feedback and talking with everybody, because a lot of times I feel like we really need to be involved, and you need to be involved every step of the way to help everyone understand, because it's very difficult to understand if you're not living with whatever it is that they're trying to fix. You know, and it's definitely a process. It's something that takes time, but that's what I would say is the most important, is having us involved with the process so that we can give insight, lived experience, and give our thoughts and feedback and opinions, because we are the ones that have that knowledge, really.
Right. Nothing about us without us.
I did think of something. This is Cynde.
Okay.
How about having medical students of different schools have at least one mandatory class about disability sensitivity, or something like that. People with lived experience come and talk about their experience, and it would be a mandatory. You can't graduate unless you take this class. Maybe.
No, that's perfect. That's a great addition, Cynde, and I think that would be lovely. We have tried to do that. Medical schools, if you got anybody from medical schools out there, or nursing schools, or dental schools, or ophthalmology schools, please press for that. We would love to see that happen. And the other thing I would just say about this question, which I think maybe it's getting to, although Christy and Cynde's answers were perfect, is that people with disabilities don't need to be fixed. People with disabilities are not just a diagnosis. We are not like waiting out there. I know I've had people even come up to me and say, well, don't you use those artificial arms and legs? Don't they work just like the real thing? Why aren't you using those? And I have to say, well, actually they don't work very well for me, because I don't have any arm stumps at all to use the artificial arms, which they work much better for people who have arm stumps. And I can't walk on artificial legs because a lot of your balance is tied up in your arms, or learning to walk, from a young age with having legs. And so that's just not something that I can really do, because I just fall if I try to walk on artificial legs. So, the things that people think of for amputees, whether they're congenital amputees or amputees later in life, are not things that really work well for me. I use things like mouth sticks and Dragon Naturally Speaking at work, so I can dictate things, and I dictate things on my phone all the time. So there's lots of different technology that's out there that's available, but it doesn't have to be something where it makes you look more normal. I feel like a lot of people think that, well, if you wore these limbs, you would look more normal. And, I don't care if I look normal or not. I'm not normal in any sense of the word. And I am who I am, as Popeye would say. And so you need to be, okay with yourself, and healthcare providers need to be okay with you as well, and not just be trying to fix you by providing, all these things that maybe don't work well for you or you don't want.
Right. And just for the record, Jan, I don't think I've ever met anybody who is normal.
No, me neither.
So
Yeah.
that's great. All right, Pam, back to you.
All right. Well, actually, we had someone who made a comment, and I find this very encouraging. It says, I work for the Governor's Commission on Disability in New Mexico, and then we're working with the University of New Mexico's rehab department on an 18-month curriculum on disability topics. And they're going to be trying to publish the curriculum for use by other residencies. So that's very encouraging to know that there is a curriculum out there that's being used. So
way to go, New Mexico. All right.
Yeah. And if you guys think about it, it's like you have to take an entire field of people who have been trained to fix what's broken. I mean, that's exactly what they get in training in medical school, and reteach them that people with disabilities aren't broken. They don't need to be fixed, and give them what Cynde was saying, that disability culture orientation, so they can change their orientation toward people with disabilities.
It looks like Christy might have a comment.
Yeah, I just wanted to comment. That's why when we started off, I took off my pink hearing aid and my pink cochlear implant, because growing up, it was always about, don't worry, we'll get the color that nobody will see. It'll hide behind your ear, and we want it to blend in. You know, people meant well, but I already was feeling pretty invisible. Hearing loss is invisible, and that was making, you know, I felt invisible then, like it was something that was supposed to be hidden. So this is the very first time in my life that I've ever had pink. I love it, and I don't feel, like Jan said and Cynde said, I don't need to be fixed. I just need to have access. The communication needs to be fixed. For me personally, the communication's broken, not me. So we both need captioning to have access to each other. We both need an ASL interpreter if someone steps. So it's, nobody needs to be fixed. I love that.
Well, I cannot thank Cynde, Christy, and Jan enough for being willing to share your experiences. I just want to let you know that in the comments, we are getting several people saying we appreciate it, that this has really helped them to be able to see things differently. And so thank you for your willingness to share and to help us better understand the medical field and the things that maybe we need to do so that we can continue to have more accessible and more accessible healthcare experience. So at this point in time, let's go to, do we have another slide? Yes, thank you. So we want to wrap up for today. So, and if you need to contact your ADA center, you can reach your ADA center by calling 1-800-949-4232. So, and that's voice or relay. You can email your ADA-TA center by visiting adata.org/email, and then you can select your center from there. You can visit the ADA National Network website at adata.org, or join our email list at adata.org/newsletter. So you can also follow us on social media at X, also formerly known as Twitter, at ADA National, Facebook at ADA Network, and LinkedIn at ADA-National-Network. So, and you will receive an email with a link to the online session evaluation. And we ask that you complete the evaluation for today's program, because we do value your input. And we, again, want to thank our speakers today for sharing their time and knowledge with us. And we thank you for attending today's session, and we wish you a great day.
Thank you.
Yes.
Wonderful.
Great job, ladies. Great job.
Thank you, Anne and
Thanks
Pam
for
and
having me.
Gabe and Cynde and Christy and our interpreters and our captioner. We thank all of you for being here, with us and help us making this a success. So thank you all so much. And to everyone online, please save the chat. There's a lot of really great resources there.
Mm-hmm.
Please remember to save the chat.
Bye-bye.
Oh, some people are saying they can't save it. We'll make sure we get the resources out to you.